my gosh.
Oh my
Oh my gosh.
Oh my
Oh my
God.
gosh.
Oh my God.
You're doing it.
Okay. So here we talked about muscular issue, muscular tension issue. Now, muscle are supposed to create tension. Yes, you grab something. It's so no, it's just a function of tension. But if tension doesn't go away when you are not using that is the problem, persistent. Okay, so understand the tension issue. The problem of this is unable to relax. The muscle cannot relax, and that is the problem. Okay, so how do you relax the muscle? And that's the key. All right. Then structural issue, because muscle has to work with the bone. Okay, so when the bone and structure is kind of not in the right place, you also have pain. Okay, but the actual point. Okay, so if you stimulate one, relax the muscle, then your back here will be nice. Okay, or some people come in and say, oh, you know, my muscle down here in the front of this quad is always tense, right? Something here, the same point, right? Yeah, because what is it's contracted, then obviously you're going to start doing like that, and then your body say no, it should be straight. So you have always stretching that muscle that's don't want to be stretched. Okay. Makes sense, right? Okay. So this one is essentially just from the acupuncture perspective. This is what we do, right? The blue one here is liver meridian. Okay, and so liver meridian goes from what? Inside, right? Going to the middle, right? Okay, and it goes to the center of the body, yes? Okay? Actually, it reflects this muscular issue. So when they're tight, the liver meridian will be tense. Okay? And it actually is the semi-muscles is working to stretch. So you have to do a liver 7, liver 8, because this is where the muscle goes inserted. Okay? And the right side here is very interesting because tendon meridian. Yeah? Tendon meridian. And it's a span of tendon, how they go, right? So if you look at the right side, the tendon meridian of liver, it only goes to genitalia area, because you don't know what other place it goes. Actually, goes to the whole body. Okay, you have muscle connection, right? Okay, but in terms of points, the left side is talking about how they are connected. Okay, the interesting here is that. So the tension goes to the ischium, okay, and then when you tuck, right, you feel this, the whole pelvic has been tucked, right? So the effect is going to be a lot. It's going to be going through this way, okay, but if you look at the meridian, it actually a lot of people say, okay, it's going to the same side, okay, yeah. Only a few of the literature says going to the across. Okay. Next time when the people have problem down here, okay, you can check see whether there's pain down here. Okay. And I suspect you're going to find both sides have pain. All right? Okay. And this is once you know how the tension is going, then all of a sudden you know more about where to find the place to treat. Yes? Okay. Now, So yeah, so I think this I will talk about if this is too tight, what's going to happen? How many places of the body is going to be problematic? Lots, right? Here, could be over here, yeah? Could be over here too, yeah? Okay, so all these problems, if you just treat it, it may not work because the problem is right here, yeah? So that's why liver 7, liver 8 is always my choice, okay? So this is one of the things. People complain about the hip pain, right? Right here. Okay, and I'm sure you guys, okay, let's try to needle here. Yeah, the more the better, right? And it really doesn't work very well. Okay, but if you do a needle on liver 7, by the way, does everybody know what liver 7, liver 8, where are they? Yes? Okay. Most important, if you don't get anything, this is the only thing you have to learn. Okay. Okay. It's kind of it's an insertion of these several muscle. Yeah. Okay. You have a spleen 9. You have liver 7. You have kidney 8. Actually, they are all essentially the same thing. Okay? Because it's the same location. Okay, so all of a sudden you say, okay, how come they all have same function even though they are different meridian? Because structurally, yeah, same. Okay, and this is the early, I wrote this one about 8-9 years ago in the paper, say, okay, this is why you have low back pain. Because all this semi-membrane and semi-membranous or semi-tendinous muscle is at fault. And this is where you have to pay attention to that. Right? Okay. It has to do with the Q angle and how they structure. Okay. So now some of you probably already had a question. What am I talking about? Why do you treat these points? Okay. And this is essentially we already talked about last time, just a little bit for some people who wasn't here. Okay, most of you are not here. Okay. Important to remember, right? In the muscle, we are talking about nerve, right? So we are looking at a muscle nerve. There are only 3 kinds of them. Surprise, right? One is motor nerve. And when the motor nerve excited, muscle contract shorten. Okay, and this is how body makes you work. Contract the muscle, send the signal to the motor nerve. Okay. So, why would anybody use the motor nerve or motor neuron to release muscle tension? It doesn't. Okay, but if you look at acupuncture point, motor nerve is mostly centered at the center area of the muscle, of muscle belly, yes? Acupuncture point, we don't use that. We don't use it, because we know that it doesn't work, right? Not for treating the pain, it doesn't work. Right? The second one is called muscle spindle. This is actually in line with the muscle fibers. So it's monitoring how much muscle has been stretched, and this is very important to protect your muscle, yeah? So if muscle is stretched too much, like you hit it with a hammer, okay, and the muscle stretched, and you will all of a sudden you got contraction, right? Yeah? To protect it, right? It actually kick, right? Kick. Okay, because spindle says no. Okay, so this is nothing we will use, right? We don't want muscle contract, right? Okay, so that no, we don't excite it. The third one is called the Golgi tendon organ. Okay, the picture here, okay, on right lower side, that is kind of presentation of Golgi tendon organ. Okay, which is actually a connection of all the muscle fiber. Each one Golgi tendon organ would monitor, connected to 5, 6, 7, 8, depending on where, muscle fiber. So when these muscle fiber they are contracted, then the Golgi tendon organ will send signals, say, okay, and depending on how much that is contracted, you send so much signal from the Golgi tendon organ. So it is monitoring how much tension there is. Okay? Because your body has to know how much muscle tension is there. Because it only is when the motor neuron is activated, it contracts, it doesn't know how much to contract, right? Say I want to digress, but how much the motor neuron has to be excited, you don't know. But the Golgi tendon organ tells you, okay? The Golgi tendon organ is located, okay, I think I didn't mention that. It's between the muscle and the tendon. So it's almost very close to, it's on the tendon, not on the muscle side of the tendon, not the tendon side. Only few of them are on tendon side, okay? So if you look at all the joint area, that's where you find the point. This is the insertion of the muscle, yes? And you can also use the origin of the muscle. They also have Golgi tendon organ. Okay. Every single muscle has Golgi tendon organ. Yeah, makes sense, right? Because otherwise, how do you know how much tension to use? Okay. So it's so important. How come people don't realize that? Okay. So here just a brief structure, right? Of what muscle looks. Okay. And so here big muscle. Okay, and then it has many fascicles, they call it bundle of muscle. And then it goes into a smaller one, is muscle fiber. Yes? Okay. The motor neuron, each neuron would be innervated to several 4 or 5 of muscle fiber. So when the signal comes out, that whole bunch of 6 or 7 all contract. Okay. Okay. But because there are so many of them, so it could be here, this bundle, that bundle, different motor neuron will fire to maintain a tension. Question? Yeah. Yeah. Okay. Okay. And this is what I'm saying. Okay. The blue one and the red one, these are all just one single muscle neuron, okay, and that controls several nerves, fiber, okay, and when one fire, those several ones is together will be contracted, and so they take turns. And we can observe how they are working just by put the electrode, right, over the skin, because there is electricity going through and can monitor that. Okay, so on the right side you can see that's what you see. Okay, like combine all these several motor neurons firing, so you can tell these patterns. Okay, that tells you how it works. Okay, this one is what the Golgi tendon organ, right? So it's a capsule that is connected to, in this situation, by 8 muscle fibers. Okay? Okay, and then nerve sends out the signal to the body. Okay. How big is this capsule? Your 32 gauge needle is about 3 or 4 times, 2 times, 3 times the size of the capsule. So you put a needle around the area in there, is actually much bigger than the capsule. So when you do that, you actually stimulate several Golgi tendon organ. Okay. Only several. Okay. So that's why you cannot just put a needle in there and say, okay, that's it. You had to do your work to stimulate so that more Golgi tendon will be excited. Why do we do that? The motor neuron will contract the muscle, yes? And muscle spindle would prevent you from overstretching. How do you relax muscle? How do you relax muscle? Anybody ever think about it? Yeah. Interesting, huh? How do you relax muscle? This is our main job here, acupuncture. We want to relax. How do you do that? Anybody?
GTO.
But GTO is only send the tension of the muscle. That's all. Does not relax the muscle. Because you cannot have something that you stimulate and muscle will relax. That will be disaster. Okay? So here is quite clever, and we do it all the time, actually, 3,000, 4,000 years ago. The place, the control center, we call it a central pattern generator, which is control the tension of the muscle, yeah? Will send a signal to the motor neuron, right? But it has to know how much is sent. And then when the feedback from the GTO signal comes in, they say, okay, this is what it is. So what if we stimulate artificially the GTOs? Think about it, right? If you do that, there'll be more signal from GTO say, oh, it's very tense, yes. So the CPZ, right, central pattern generator, would have to adjust the signal sent to the motor neuron, right? It's too much, so you had to reduce. So muscle would relax. Yeah? See? So we are tricking the body thinking that you had too much tension on a muscle. You had to reduce it. Okay? Interesting, huh? So people have been using GTO, they didn't know how things are working, and sometimes it works, sometimes it doesn't, because it's not GTO. It's a central pattern generator, but you make them think that it's too much. Okay, and they have an experiment actually several years ago in the paper. Okay, what they do is that in the paper is that. Okay, so you have the calf muscle, yes? Okay, both sides. So they will stretch the calf muscle, and you know the calf muscle is going to have a lots of activity on motor neuron, yes? Then they put a pad on here, on the bottom side here, tendon area, and apply electricity, stimulate, the tendon organ. And this you can see the motor neuron start to fire this and this. And they actually, when they have enough, there'll be no activity on motor neuron. Cool, huh? But nobody knows what the U is for, except us. Okay? So what we
are... Is that the same idea behind Easton?
Huh?
Is that the same idea behind Easton?
Yes. More than Easton, you pump it, you pressure it. They all stimulate the GTO. So there's not one thing you can do to relax the muscle, but you have to know where to put it, how to do it. Vibration actually reduce, actually stimulates the GTO. vibration. So now you probably want to go home and buy a vibrator, right? And it works, okay? People buy a vibrator, they don't know how to use it. It doesn't work. They work on the muscle area, and the more they do it, the more it's tighter, right? It feels good, but okay. Okay?
So you have tuning fork.
Huh?
And tuning fork
Yeah.
with the
Yeah, you do everything. You stimulate it. Yeah. I have to go tap it. This one here, okay, this is called very, very famous, been going on for 50, 60, 70 years. It's called PNF, right? Very fancy name, okay? Proprioceptive neuromuscular facilitation. What it is called hold and relax way to increase the mobility of the muscle. Increase the mobility of muscle. Yeah? Okay, so what they do is, okay, see like this person here, just pull it and then your leg will push down, right, so increase the tension, okay, for a couple seconds, and then let go, and then you will see you can move more and more, right? Okay, the whole thing is essentially stimulating the Golgi tendon organ. Okay? But in the old time, they think Golgi tendon organ would cause the reflex. Okay, so the reflex makes the muscle relax. But if that were true, then why do you have to wait several seconds and then it will relax? That doesn't make sense. So reflex is immediate, right? Because the learning process, Golgi tendon organ learning process. All right. So now you know the other people is already applying the Golgi tendon or concept in reducing the muscle tension, increase the mobility. Yes, we are not only one. Okay. Okay. So how many things you can be used to artificially stimulate Golgi tendon organ? See? You can do a vibration, right? So you can do the pressure, yeah? You can do a vibration. It's electrical stimulation. Needle is the easiest one because one time you can do 10, 20 points. Okay, this is why acupuncture is so good because at the same time you can do many places. Okay. Heat, max Sebastian is very good, right? Heat. Okay, hammer, you make it hurt, this feels definitely well. And people do that too. And chemical. I remember there's a book. Okay, it say bee sting would treat the arthritis. You probably.
I know people who do this, who do that on their back. Yeah, they swear by it.
Yes.
But also
It hurt like hell, right? Okay, the area is so stimulated. Okay, oh, feels so good. Okay, yeah, you don't have to go through that. And besides that, it's, actually somebody gave me that book, so I read it. Anytime the bee stings somebody, the bee would die.
Yeah, terrible.
So now you kill one bee, I mean, and then you have to keep a jar of bees, and the whole area is swelled up. Inflammation. Terrible. But we do it. I mean, people would amputate the leg in order for relieve the pain, right? Terrible. We do it. In history, in the medical history, we do all the terrible things. Okay, doesn't mean it's good. Okay, so here comes to the center point, the presence of central pattern generator. Okay, this is where everything is. That's why we have all the pain that cannot go away. Your central pattern generator does not like what you're doing. Okay. And initially, where is the central parent generator? Where is it located? It's in the spine. Typically, we say the movement is barren, but actually a center control. Okay. How do we know the central parent generator? I think this is the guy who slide out is Sir Harrington. Okay, many years ago. They talk about this is Charles Sherrington, 1857. Okay, 1952 when he died. He's the one curious. He talked about. You look at the insect. How come when they chop the head off, they still can move from? And it's always a kind of synchronized pattern. All the limbs, the leg are synchronized. I started looking at what is the cause in that, okay? And this is where the central pattern generator concept comes from, okay? It's about this synchronized movement of the limbs. It's not controlled by the head, by central control center. It's by the local, the spine, okay? But it's actually the CPZ and all the study here, most people are trying to find out, well, maybe it's a neural pattern such that it make it synchronized. But CPZ actually works much more pervasive and important than that. It actually control all of the muscle tension throughout the body. Okay, so it's a lot of work for that to do. So it's probably more than just one CPZ. There are a couple of CPZ talk to each other. Okay, I think the idea here is probably two. One is medial, one is up here, and the other one is down here in the low back, neck, right? See, the neck is lower. We still go back neck and low back again, because those are where the action is, and they need a lot of neural network. Okay. And we still don't know a lot about structure-wise CPZ, and that's not surprise because neural networks are very complicated. Okay, so when you walk, right? Okay, think about it, right? When you go like one leg forward, at the same time you would do what? This one, yes? Because if you just do this, your body will twist it, rotation. Okay, so your CPZ had to make sure that it's counterbalance that, so you would turn it back. This one here, go this one, to prevent it from turning, right? But then you have up and down issues, so this one has to be balanced by this one, right? So that your body could go forward, okay? So just by looking at the way you're going to balance your center of gravity, it has to work like this, okay? So people spend so much time studying this the circuitry that could do it, this pattern. Really, if you just look at how the body could balance itself, right? It's there, okay? So every time you raise the hand, right? Very easy, right? Nothing. Actually, it's a lot of things going on. Actually, this muscle, okay? We have to support as the muscle, right? Even more so, it's this muscle. When you do this muscle doesn't work initially. This one has contract about 50 milliseconds before you do this. Just think about, okay, I'm going to raise it, and this one has contract. Because CPZ knows stepwise. You say, go, raise the hand. This one has contract, and then this, you can do this. So I have, I think we have a patient, I remember where is it? Yeah, I have a patient recently. She had some kind of ovary problem, okay? And then the whole area is inflamed, and then it's getting better, still kind of tender. And so she said, this tender, she had problem with it. She had problem with it. Shoulder pain. here it's quite interesting. Shoulder may not be painful, but this one make you not able to do it, so it will be painful. See how that works? Okay, so for this patient, right, if you want to treat this one here, you cannot treat it unless you treat this one, right? Yes? So I put a lot of heat down here, okay? And this one has to do with the tension up down. So I treat that. So this is better. Okay, the pain goes away. Okay. Right? It's all about CPZ. Okay. Okay. Now, and this is this situation. For most people, when they don't have problem here, and they could not raise the arm, what is happening? It could be here problem, right? The problem could be here. But when you have problem down here, the body is trying to, and this is what a CPZ, there are two functions. One is to maintain your stability, CPZ. The other one is to prevent you from having pain by restricting the muscle use. And this is actually even more problematic for us because when you have a pain raising it up, right? Say, oh, I have a joint problem. Actually, this muscle down here is going to be tight. Prevent you from doing that. Yeah. CPZ going to tighten this muscle. So, if you look at our treatment, right, for people who have shoulder joint problem, you treat the stomach 38 because that muscle is tight, so you relax that, so you can do that. Yeah, now you know, right? but remember that we have hurting, right? Hurting also goes over here, right? So what if you do hurting? Would that make it better?
Probably.
Course. Yeah. So you do 2 points and also, huh? What the problem is?
Do you do it on the same side?
Yeah, yeah. Because when you raise it, you can see this, the tension, right? Okay. The meridian actually tells you where the tension line is. That's what meridian is. Okay, secret, right? On top. Okay. So raise this one here. Actually, your muscle has already have to shift this side to balance the center of gravity, right? And you don't think about it. You just live. But when you have problem, then you have to think about it now. Okay, otherwise you cannot treat it, right? Okay. Interesting, huh? Now let me ask you a question. So when baby grow up and they start to learn to walk, yeah, they always have to raise the arm. Yes? Why?
Balance.
Huh?
Balance.
Yeah, balance. How come? Physics.
Because their CPG doesn't know.
CPG is trying to, it kind of, yeah, it kind of senses.
Yeah.
CPG senses and react. Okay. So how? Why? Okay. Okay. Now, see here are a couple of things that, and this is where I didn't like the way they study the CPG because they're only kind of interested in the rhythmic part of CPZ, which really has nothing to do with practicality. CPZ, because it has to balance all this, it has to have adaptability. In other words, if you see something, okay, your body has to be able to react immediately, okay, and give you different patterns. And if you have a problem in your body, it has to adapt to that, okay? So CPZ, even though it's all the program you already learned, since a kid, you have these, it has to be able to adapt these input from outside all the time. And then come up with the right pattern. All right? We call adaptability. So when this leg is in pain, you have to use different pattern to walk, yeah? Right? Okay? And the problem here is CPG, remember that, and then next time your leg is good, but you still cannot walk back, right? It's the same way, right? Okay? And this is what happened to people who have other injury, because so long with pain and their body start twisted. Even though they can do something better, but they cannot change it because they have established CPG physiology. Okay? Okay. And this is called modulation by pain, right? Whenever there's pain, your body is going to, CPG is going to issue different kind of pattern to move it yourself to accommodate the pain and accommodate to maintain the stability. True objective. All right? Okay. And then if I allow it to go on forever, then it becomes chronification. And this is where the doctors really hate. Because people come in, well, this small pain, and they just couldn't get better. Because body structure is already changed, coupled with CPG already determined this order of what it should be. So you have to change everything in order to have it go back. But this is not what their job is. Doctors don't care, right? It's not their job. They'll give it to the PT. Physiotherapy do that. And physiotherapy, there's a problem because they said, oh, we only have to make you work, exercise. They don't really treat the problem. So it really has a problem. Okay, so this is called the anticipatory CPG, the one that you raise the arm and right arm and left side. Tighten up. What is that? How does that do? It's called transverse abdominis. The muscle is big muscle. The red and pink one is the TA. That contract. And what does that contract do? It actually pull the spine in that direction. So to compensate for this one, it goes that way. Right? And this is very important in terms of, this is what happens when you don't pay attention to, okay? So this is just kind of CPG thing, okay? You look at the arm and leg, okay? All these walking, cycling, it's all controlled by the coordination of so-called CPG, right? Common called the neural elements, okay, CPG, okay? But CPG had to get all the feedback of the eyes, ear coordination, okay, to know how it is, all right? Okay, and this one, the next one is probably even more abstract, right?